Hi, my name is Stéphane Lair. I'm the Regional Director for the Canadian Wildlife Health Cooperative for the province of Quebec. When we talk about emerging disease in wildlife, we have to mention the white nose syndrome of bats. Since the first documented cases in 2007, this syndrome has caused the death of a very high number of bats in North America. This syndrome is actually caused by a fungus that was probably most likely introduced from Europe to North America. And there's some population of bats that were really abundant before the occurrence of this syndrome, that, like the small brown bats, for example, that are threatened today because of this pathogen, are really facing an unprecedented event here. The first challenge associated with the characterization of this condition was to try to identify the fungus. The first researchers that work on this had a hard time to grow that fungus because it doesn't really, it's a very slow growing fungus, and it doesn't grow at all at the usual temperature that we use for culture. After trial and errors, they were able to culture it at using low temperature incubation. The name of this fungus is now known as Pseudogymnasium destructans, and the identification of that fungus enabled researchers to develop some molecular testing, such as PCR, that are very, very useful now these days to diagnose this syndrome in affected bats. Usually what we want to have is a positive PCR, which is telling us that the pathogen is present, combined to histological lesions, so microscopic lesions on the skin of the affected bat, which are quite characteristic. As soon as the first cases were reported in New York State in 2007, researchers and biologists interested in bats in Canada were really wondering if the disease was going to go north and affect Canadian territories or Canadian bats. In order to evaluate that, a surveillance program was developed by different provincial and federal agencies in collaboration with the Canadian Wildlife Health Cooperative laboratories. The first challenge that we were faced with this program was that only a small proportion of hibernaculum, so hibernation sites of bat, were known. And some of these sites were actually not easy to access, and they were even dangerous, such as abandoned caves, or abandoned mines, I should say. So it was not always possible to survey all the sites. Nevertheless, we were able to document cases because bats that are affected will have the tendency to fly out during the day, to fly out of the hibernaculum, so they could be detected. So the first cases were seen in Ontario and Quebec in 2010, and since that we have also seen some cases in the Maritimes, the Atlantic provinces. Today, white nose syndrome is actually have been diagnosed in 5 provinces and 25 states, so it's really covering quite a large area in North America. Fortunately, there were some hibernation sites that were well known by researchers, and population survey were done prior to the occurrence of white nose syndrome, and that enabled us to document a dramatic decrease of affected population. Actually, in some sites, more than 98% of the bats just vanished following the introduction of this pathogen. So quite significant effect on the population of bats. In the province of Quebec, the ministère decided to stop entering caves in order to decrease the risk of propagation of this fungus from one cave to the other, or one site to the other. Winter inspections of the area around hibernation sites were, however, done when possible in order to try to detect carcasses of bats during the winter time. This is better than nothing, but we have to remember that a carcass will not stay there for a long time because it would be taken rapidly by scavengers like raccoons and crows. So if you don't find a bat in a site, doesn't necessarily mean that the disease was not present, or mean that there were no mortalities. Last winter, our lab in Quebec only received a very small number of cases of white nose syndrome. We only had the 2-3 cases that were confirmed positive. And I guess that could be seen as a good news, but I think it's more an indication that or it more reflects the fact that the bat population decreased so much that there's just no bat left to die, if you want. So it's a pretty scary thought. Despite the challenge associated with this kind of surveillance of disease in wild species, I think it's essential to continue to monitor the impact not only of this condition, not only for bat population, but also for the entire ecosystem. It has to be remembered that bats are eating a large number of insects, so we can wonder what would be the impact of the significant decrease in population of some species of bats. This type of surveillance program is better done as a collaborative effort between governmental agencies and non-governmental agencies such as the Canadian Wildlife Health Cooperative.